Yeah, every other day we've been hearing predictions about just how bad this crisis is going to be. Today's, though, are pretty much the worst. Not just that the UK is going to do badly, but it could do worse than the global economy as a whole. So this afternoon, the International Monetary Fund predicted that the global economy as a whole will shrink by 3%. The UK economy, they think, could shrink by 6.5%, worse than similar economies in the Western world. And then, of course, those numbers that you went through, Kathy, from the OBR. Dire. But here's what's stark about them. Usually when the OBR come out with gloomy predictions, government will come out and say, oh, they're wrong, or downplay them, or say it's not as bad as that. Today, that did not happen. The Chancellor's message, these are hard days, and it's going to get harder. The clatter of one lone machine in a room that should echo with industry. So this announcement was made a few weeks ago. What's the state of your business now?
A shadow of its former self.
Orders have dried up, the workforce has halved, 4 furloughed, 1 redundant. And the pattern in this one embroidered corner of the economy is being repeated across the UK. Today, the nation's financial watchdog warned from April through June this year, the economy could shrink up to 35% if this lockdown stays in place for up to 3 months. How does this feel to you? Is this survivable?
You know, if you could put a ring around it and you knew how long you were working with, if you had a date to work towards, you could gather all your resources and allocate what limited cash you have towards that deadline. But the uncertainty makes it impossible to plan. You just don't know what is going to happen and for how long. And so I don't know. I don't know how anyone could say whether they're going to survive or not.
Faced with the bleakest economic predictions yet from the Office of Budget Responsibility, in March the Chancellor for the government's daily press conference. His take, the struggle is real.
These are tough times, and there will be more to come. As I've said before, we can't protect every business and every household. But we came into this crisis with a fundamentally sound economy. So while those economic impacts are significant, the OBR also expect them to be temporary, with a bounce back in growth.
The Chancellor said this was not a choice between the economy and public health, but in his next sentence made clear where the government's priorities lie.
The absolute priority must be to focus all of our resources, not just of the state, but of businesses and all of you at home as well, in a collective national effort to beat this virus.
Bleak high streets make bleak predictions easy to believe, but the OBR admitted their data was just one possible scenario based on a 3-month lockdown followed by 3 months of partial restrictions. Were that the case though, they gave this for context. The First World War, Spanish flu, the Great Depression, World War II and the global financial crisis. Economically, coronavirus could be worse than all of them, but possibly followed by a recovery just as dramatic. The long tail of this crisis, though, has a severe sting in it: unemployment. In the OBR predictions, unemployment could rise by more than 2 million, to the point where, in this 3-month period, 1 in 10 could be out of work. They also add, though, that unemployment could, quote, decline more slowly than GDP recovers. In other words, lots of people out of work for a very long period of time, even after the economy starts to bounce back.
The challenge in the UK, it is going to be harder in many cases. We've got a bigger proportion of our labour market, for example, which is consumed by certain forms of self-employment than in other nations. That means that we're going to have to tailor what's put in, but government needs to try and have that long-term perspective if it can.
Among the many jobs that look uncertain tonight, the 2,500 workers at women's fashion retailer Oasis and Warehouse, who are expected to appoint administrators imminently. In this unique crisis, though, the government's main focus for now is not lost jobs, but lost lives.
Well, I'm joined now by the Conservative MP Mel Stride, who's chair of the Commons Treasury Select Committee. Mel Stride, these numbers are just so vast today. Can you make sense of the kind of economic impact we might be looking at here?
Well, I think the key is short term and then longer term. So what the OBR is saying is that they have this illustrative scenario that says if we maintain the current lockdown for 3 months and then have a further 3 months of gently stepping back from that, what's the impact likely to be? And what they're saying is that in the short term, there will be a rapid contraction of the economy and then a rapid bounce back afterwards. And they're assuming that there's going to be therefore no scarring of the economy, as economists would call it, longer term impacts. Now, what will determine whether that happens is going to be the length of this lockdown and also the level of government support that it's providing to the self-employed and to businesses and so on, which are the major focus of my committee at the moment.
So taking those 2 points then, would you urge the government to, as soon as the deaths start to fall, to start urgently looking again at lifting the lockdown, first of all, and I'll come back to your second point in a minute?
OK, well, once you lift the lockdown, you've got to be sure that that is done in a manner that doesn't lead to the NHS being overwhelmed. It doesn't lead to a huge spike in this disease, which in itself, of course, would have an economic impact. So this isn't simply a case of lockdown means damage to the economy. No, lockdown means we're out of the economic damage at all. So it will have to be led by the expert health advice, and government will have to take that advice and take those very difficult balanced decisions.
Just addressing the second half of your first answer and talking about the scale of government support to ensure that there is this bounce back that the OBR quite optimistically predicts under its scenario. Given that many self-employed people still don't qualify for help and lots of businesses are reporting that they're not getting the emergency loans, how urgently would you like to see the Chancellor stepping up and addressing those gaps?
Well, inevitably what has happened here, Kathy, is that this huge problem has arisen. Government has had to go in a massive, bold and unprecedented way in terms of fiscal and monetary support, and it's had to do it at considerable pace. And what happens when you do that is you end up with policies that have hard edges. So what my committee is doing is looking very closely at, say, the issue of loans to small businesses, where we're not satisfied that those are getting out to those businesses quickly enough, and looking at how, for example, that policy could be improved. And the government has made some improvements in that area. We're also looking at the support for the self-employed. I know there are many who are earning some of their income through dividends, through companies that they work through. That currently is not taken into account when it comes to support. So we're pressing the government on that.
But how urgently? I mean, this is happening now. People's livelihoods are affected right now. How urgently does the Chancellor need to come up with a solution?
They will be working 24/7 on this. They've already made a considerable amount of progress, but inevitably there are areas such as these I've just identified and many others where more progress needs to be made. So what the Treasury Select Committee is doing is having witnesses before us, looking at those issues. I've written to the Chancellor, I've had the Chancellor appear before my committee to really press on those government support measures, because if we're going to bounce out of this at the end, and that is possible, then we have to make sure that we protected the economy as much as we can in the intervening period.
The IMF figures predicted that we'd be worse hit than the rest of the world. Why do you think that is?
Well, there are so many projections. And in fact, if you look at the OBR's report, they look at the various international projections as to what will happen to various economies around the world. And I don't think it's particularly helpful to seize upon one particular set of figures, because economies are going to be affected quite dramatically, and it's very difficult to predict exactly what's going to happen. But in terms of the UK economy, we're a consumption-led economy, so 80% of the UK economy is made up effectively by consumer expenditure. And there's no doubt that if you look at the way that this virus has impacted the economy, consumer expenditure and demand is a very large element, though by no means all of it, but a very large element of it.
Mel Stride, thanks very much.
So 1 in 5 of all deaths in England and Wales in the week ending April the 3rd are linked to coronavirus, with the overall death rate pushed to a record high. That includes 406 people who've died with the coronavirus outside hospitals, more than half of them in care homes. Charities say the virus is causing devastation in their sector, with the UK government under pressure to give more information about deaths in care homes. Over now to our chief correspondent, Alex Thompson in Torquay. Alex.
Well, if civilization means anything, it means we look after those who can't look after themselves. And that's why, quite rightly, the whole care home system has come to the fore in this story. And let's remind ourselves, that doesn't just mean elderly people. It means a whole range of ages and disabilities as well. And they're caught in this terrible bind, more acutely perhaps than the NHS, these two fundamental problems which we can't seem to solve fully. The lack of PPE, protective equipment, no comprehensive delivery of that in the care home system, and the lack of comprehensive testing. These fundamental things that we keep reporting week in and week out. That's why you're getting the litany of these awful stories. Multiple deaths in a care home in East London, then more recently in County Durham, in Stanley, and right now as I speak in Devon, just across the border in Cornwall, another ongoing situation. We understand there could be more than 10 deaths in yet another care home. And that's why here in Devon and across the southwest and now throughout Wales and England, care home managers and care home owners are saying enough is enough. We will not go along any longer with the guidance being issued by the government on this COVID crisis because, frankly, they say it puts our residents in mortal danger. Clouds over the English Riviera, not the place you'd expect to find open revolt against the government, but they've had enough. Here at Warbury's nursing home in Torquay, a care home crisis that could be anywhere in Britain now. PPE, personal protective equipment for staff, will run out in days. So you've got a week. Then what, if you can't get new stuff?
I don't know. This is what we can't get answers for. The stockists that we use and everywhere else, we've been promised from especially the government that they would bring an emergency pack, emergency supply. That hasn't turned up.
In the worst crisis this country has ever experienced in regards to a pandemic, the very companies that Mr. Hancock has put forward as being the people we should call are closed for the Easter weekend in a pandemic. I find that extraordinary, and it just shows what a shambolical way the care industry, the social care industry, is being treated by government ministers.
So we called those PPE suppliers ourselves yesterday.
Our offices are currently closed. Our business hours are from 8 o'clock to 5 o'clock, Monday to Friday.
Our office hours are 9 a.m. to 5 p.m, Monday to Friday.
Well, there's been about 8 million pieces of PPE delivered to over 26,000 care homes, home care providers and hospices. I'm sure that they would like more. We are continuing to try and produce more domestically as well as procure more from abroad. But overall, we still have to prioritise the clinical use of PPE.
And yet so much of the care sector has been left feeling under-equipped, undersupplied, undervalued.
And I don't think there's been enough support there for care homes throughout this, enough like care packages as such, and I think it's just we have been forgotten about.
Today the Office of National Statistics announced 217 care home residents in England and Wales died from the virus up to April the 3rd. 13 at this care home in County Durham alone. The owner of Warbury's blames government policy directly for this rising death rate in care homes, which is of course ignored by the daily UK government figures.
I think it's an absolute disgrace. It is clearly going to introduce death into care homes.
The reason for this anger? Current government policy pushing recovering COVID patients from hospitals into care homes. The latest guidance from the Department of Health and Social Care says homes should take patients who have tested positive.
As part of the national effort, the care sector also plays a vital role in accepting patients as they are discharged from hospital. Some of these patients may have COVID-19, whether symptomatic or asymptomatic. All of these patients can be safely cared for in a care home if this guidance is followed.
Remember that key phrase, if this guidance is followed. The problem with the guidance, though, is that it rests on two things. One, a fundamental provision of testing throughout the NHS and beyond. And two, the wide provision of proper PPE, personal protective equipment, for people working in the care home sector. This controversial policy is driven by the claim that the NHS has a bed shortage.
Hospitals around the country need as many beds as possible to support and treat an increasing number of COVID-19 cases. This means the NHS will seek to discharge more patients into care homes for the recovery period.
Those with relatives in care homes across England and Wales say this policy without adequate PPE and testing is indefensible.
It's like inviting someone with the active virus into your home or my home. It's ridiculous. We are being in lockdown. We are enforced into imprisonment not to spread or contract the virus. And yet the government think that this is a good idea to actually invite it in, push it in to care homes. It's horrific.
Which is why care home owners and managers from Torquay to Tynemouth are now calling time, refusing to take hospital patients with COVID, only those who have tested negative. For the first time, a significant health sector is now turning on the government and saying, no, you're wrong, we will not do this. Alex Thompson, Channel 4 News, Torquay.
We did ask for an interview with a government minister to talk about the effects of the coronavirus, but were told for the 8th day in a row that no one would be made available. Well, today's figures suggest the overwhelming number of coronavirus deaths in England and Wales take place in hospitals. But with coronavirus outbreaks reported in 37% of care homes in Scotland compared to 13.5% in England, are we getting a true picture of the number of deaths outside hospitals? Our Scotland correspondent Kieran Jenkins has been investigating. And Kieran, you've heard concerns that some deaths are simply not included in the official statistics.
John, yesterday we revealed a whistleblower had told us that coronavirus or suspected coronavirus was allegedly being left off some medical certificates of cause of death in a region in England. They believed that some deaths, therefore, would never be included in any official count. Well, tonight we can tell you about non-hospital deaths, deaths in care homes and at people's homes, that will be counted eventually, but fears that the process of registering deaths means we may not see them in official figures anytime soon. Now, Scotland does include some care home deaths in its daily figures. In England, it's weekly. And for a death to be included in those figures, there's a process, and it sometimes has to involve GPs viewing the bodies of the dead in person. And we've been told there are so many cases for some GPs that will simply be too much of a strain.
The thing that hurt me over the last 48, 72 hours is the fact that I couldn't see him. I couldn't go up and see him in that last week.
Jim Barnes died in a Lincolnshire care home last week. What do you think you might have said if you were able to be with him?
Not to worry. And then he would have turned around and said, you live your life.
Jim tested positive for COVID-19. In Scotland, his death would have been included in the daily update on deaths. In England, it goes into a weekly update from the Office for National Statistics.
You open your mouth for me, say, ah.
But there is not widespread testing in the UK. And so certifying coronavirus deaths in care homes has become a matter for GPs' clinical judgment.
If you compare us with Germany, they have a much better line of sight on that because they've had much more extensive testing of people in the community. We really have had almost none.
Emergency legislation has relaxed some of the rules for GPs certifying deaths, but the British Medical Association tells us there's some confusion.
There are lots of doctors asking what they can and can't do in terms of the process.
If a patient hasn't been seen by a doctor, either by video or in the flesh, 28 days before their death, then their body must be viewed by a medical practitioner in person. If not, in England and Wales, it has to be referred to a coroner. But there's concern that a backlog would mean that deaths are not being counted in the official statistics for a considerable time. The BMA has now written to the UK government with fears that where a GP is unable to view a body, the death is unreported. If a GP hasn't seen a patient within 28 days before they die, is it your concern that the process gets bogged down somehow and those deaths don't get processed quickly enough to be included in these statistics?
That's exactly our concern. We don't have enough workforce really to go around to satisfy this need. The GPs may end up with no alternative but to refer these cases to the local coroner, and of course that will severely slow down the process and will cause considerably more distress for the families.
We've spoken to a whistleblower deeply involved with the registration of deaths in an area in the south of England. They believe the new system is widely misunderstood. The whistleblower alleges on one medical certificate of cause of death, a doctor had simply written COVID-19, new policy, no verification. They say they had to go back to the surgery and say, that's not the policy. Where have you got that from? The whistleblower alleges deaths are being shunted around the system. They said coroners are trying to bat stuff back.
How are the tablets going?
They're okay.
GPs are now used to video consultations, but our whistleblower tells us some doctors believe they can view a body over video link. It's not allowed yet, but the BMA is calling for exactly that.
It's clearly not ideal. The problem that we have at the moment is that where you haven't seen them within 28 days, you are faced with the decision about going to see a body that may well carry coronavirus, so there is an infection risk. For many teams, it will simply actually be logistically too much of a strain to go and see, a number of dead people. So you're in a situation where the GP may simply have to decline to produce a medical certificate.
Across the UK, deaths at home and in care homes can only be counted when the process of death registration is complete. The longer that's delayed, the less we know about the true scale of this crisis.